I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and this is a made-up case of a 31-year-old who was diagnosed with high-grade ductal carcinoma in situ after experiencing nipple itching as well as a single episode of bloody nipple discharge. The story begins 2 months prior to diagnosis when she started having nipple itching. She describes that sensation as deep underneath the nipple, and it would come on suddenly. It would be very uncomfortable for a few minutes, and then it would go away, and it would happen a couple times a week. She didn't have any actual physical changes on the skin of the nipple, and her right nipple and her left nipple looked identical, so she didn't think much of it. But then about a month later, she had a single episode of bloody nipple discharge when she noticed that there was a brown spot on her bra just on the right side. She went to go see her OBGYN, who ordered a diagnostic mammogram for her. This is one of the views from her diagnostic mammogram, and this is what we mean by pleomorphic calcifications, meaning that all of these white dots are different sizes and shapes. And that is pretty suspicious for high-grade ductal carcinoma in situ. You can see on this mammogram, the span of the calcifications is also pretty significant. This is a pretty large area to remove. And you can't see the whole mammogram, but they do lead right up to her nipple, which explains her nipple itching and her nipple discharge. She decided that she did not want to wait for a breast MRI and wanted to get to surgery right away. And so she chose to have a skin-sparing mastectomy because she was not a good candidate for nipple-sparing mastectomy since this ductal carcinoma in situ clearly involves her nipple, as well as direct-to-implant reconstruction, meaning that the plastic surgeon went ahead and put the implant in after her breast surgical oncologist performed her mastectomy. Unfortunately, about a week later, her breast surgical oncologist called her and told her that there was even more ductal carcinoma in situ in there than had been estimated by this mammogram, and she needed to go back to surgery for a re-excision of her positive margins. Luckily, the breast surgical oncologist and the plastic surgeon were able to coordinate a date for her within the next couple of weeks, and they were able to clear those margins, meaning that she was now cancer-free after her second surgery. Since then, she's been getting mammograms and MRIs to monitor her left side, as well as physical exams to monitor her right side, and has not had any signs of this cancer coming back on the right side or developing a new cancer on the left side.